Pitts, I recognize you for 3 minutes.
Thank you, Mr. Chairman. I, too, am sorry to see you go. You've been a great friend, great chairman, always a gentleman. We're going to miss you. Mr. Chairman, as we consider the multiple matters before the committee today in markup, I'd like to focus my statement on health-related issues proposed for inclusion and reconciliation. First, Section 1 rescinds, repeals the Prevention Public Health Fund as established by the Patient Protection Affordable Care Act. My colleagues will recall my longstanding interest in seeing this part of the health care law repealed. I previously have sponsored a bill to do just that. This year's no exception. H.R. 1085 is one I introduced in February that would repeal the Prevention and Public Health Fund, PPHF. PPHF authorizes the appropriation of and appropriates to the fund from the Treasury the following amounts: $500 million for 2010, $750 million 2011, $1 billion 2012, $1.25 billion in 2013, $1.5 billion 2014, and 2015, every fiscal year thereafter, $2 billion. The Secretary of Health and Human Services has the full authority to use this account to fund any programs or activities under the Public Health Service that she chooses without congressional input, approval, or oversight. June 18, 2010, HHS announced $250 million in prevention and public health funds dollars go to, quote, to support prevention activities, develop the nation's public health infrastructure, end quote. September 27th, they announced another $320 million in grants from the fund to expand the primary care workforce. February 9, 2011, HHS announced an additional $750 million for various prevention activities, including preventing tobacco use, obesity, heart disease, stroke, and other diseases, increasing immunizations. Now, the goals of these 3 disbursements from the fund are laudable. And there's no doubt that we must focus on preventing disease rather than simply treating people once they become ill. But we must remember this funding is over and above the amount that Congress has already decided go in these activities and the amount that Congress has already appropriated for the activities. And this should concern every member that we've created a slush fund that the Secretary can spend from without any congressional oversight or approval. No one here can tell us what this funding will be used for next year or 5, 10, 20, or 50 years from now, because this fund exists in perpetuity. We can't predict how the money will be spent, or worse, we can't even influence it. A direct authorization for any prevention or public health program should be written into the law. By eliminating this fund, we're not cutting any specific program or activity because we have no idea what programs or activities will receive this funding. This is about reclaiming our oversight role, how federal taxpayer dollars should be used. Secondly, Section 2 places limitations on federal funds to states for a period of 1 year. Under the provision, no federal funds will go to states for payments to a prohibited entity. And this language outlines the prohibited entity: nonprofit organization, essential community provider, primarily engaged in certain medical services. It also provides elective abortions to receive a large amount of federal funds in a calendar year. This provision would bar federal funding to states for providers like Planned Parenthood. And I believe this is an important step to respect federal taxpayer dollars. And finally, Section 3 would take savings from Section 2 in the underlying bill, reinvest them in federally qualified health centers, and this provision ensures that there's adequate investment and continuity of care for those most in need. So with that, thank you, Mr. Chairman. I yield back the balance of time.